Well, maybe we better just take it up a notch and try to get a common theme. And of course, the one that we landed you've all seen, which is the value of industry pharmacists. And that's really intended to be indicative of our distinguished panelists who are going to join me up here in a moment, and all of you. There's a lot of you working in the industry right now, making key contributions, kind of representing every day in and out for what a pharmacist can contribute in industry. There's about 8,000 of us now. And when I look around at pharmaceutical companies, and you do too, you can look at the different positions and say, wow, a pharmacist should be in that role too. And I think the sky is the limit there. I really do. Not everybody, it's not for everybody, but for those who want to explore that career path, and there's a number of students here tonight, which is terrific, it can be very rewarding, and you can do all kinds of different things as evidenced by our panelists here, and also the valuable pharmacists that we have. We think that pharmacists should be universally recognized within our industry as being the best professionally equipped to contribute to development of medicines, promoting the optimal use of medicines, all the things that a pharmaceutical company does. No better background. No better background. We're the medication experts, we're trained for that, but we also know so much about the healthcare team, the patient, the healthcare systems, how everybody interacts. Healthcare reform, well, I don't know if anybody's got that figured out, but we're in a good position for that too. So you look at all of that and you go, wow, a pharmacist has all the key building blocks. First question is, what's the awareness, knowledge, impression, and recognition of pharmacists' educational training?
I believe that we still have a very long way to go to really have the background of pharmacy recognized across all the functions within the pharmaceutical industry. So as Jim has described it, we are positioned to be the experts in terms of what kind of medications could be used and how to develop those and how to understand and implement clinical studies and so on, and make communications to both healthcare professionals and to patients and consumers. But we are not always considered to be that person or to be able to bring those insights into the organizations. So the question would be then, well, then what do we do about that if we realize that there's some kind of gap? And potentially, it has to be a grassroots effort to begin, right? So one by one, influencing and impressing people with your knowledge and your experience, and to help them to understand that you got it, that you know what it is that you're trying to achieve in terms of treating patients and why it's important. And to never, ever forget about ultimately the person who takes the product that you're making, and to make sure that everybody has that in their mind. But I think that we have some significant contributions to make, but I would say we still have some ways to go in terms of people understanding the value we bring, especially to the variety of different functions that are available for us to work within the industry.